everyone, my name is Annie Den and I am an occupational therapy assistant student at St. Catherine's University, and today's topic we'll be discussing about energy conservation and work simplification. Our objective for this presentation is to promote, maintain, and maximize independence with the elderly population. So how can fatigue symptoms affect the elderly population? Well, fatigue is an inevitable result of the aging process. It is a symptom that can be caused by various reasons such as numerous medical conditions like cancer, heart disease, diabetes, hypertension, and arthritis. Fatigue can also impact elderly individuals' physical and mental functional aspect. The physical fatigue are muscle weakness, vision problems, headaches, and muscle pain. And the mental fatigues are irritability, difficult concentrating on staying tasks, slow response time, and memory problems. Within the field of occupational therapy, OT practitioners teach about fatigue management. And with fatigue management, it is basically the concept of making simple changes to your routine or minor adaptations to your environment. It is possible to reduce the fatigue level significantly and allow you to engage in more activities throughout your day. OT practitioners teach about the four main P's. The four main P's consist of plan, pace, prioritize, and position. The first P is plan. And with plan, the elderly individual determine preparation required, plan sequence of steps involved in the activity, determine the workspace needed for the activity, and make sure the items are readily accessible. And make sure the space of the activity is organized, and determine the best time of the day to perform tasks based on the individual's energy level. In addition, you should allow time to complete tasks without feeling rushed, as well as delegate tasks and responsibilities to family and friends to take the workload off. The second P is pace. And with pace, the elderly individual set realistic goals for how the task will be accomplished, pace at an appropriate speed, go slowly, and take some rest breaks, as well as avoid becoming overtired by distributing tedious tasks over the week. Do tasks requiring most exertion when energy is the highest, and intermix easy and challenging tasks mentally and physically. In addition, also to eliminate unnecessary effort. The third P is prioritize. And with prioritize, the elderly individual decide which are absolutely necessary, decide personal and social activities that are really important, and save energy for those that are important and do not do activities that are not as important. And also learn how to say no. In addition, consider hiring professionals to cut down the workload. Lastly, and most importantly, position. It is also best and recommended to sit for work. Avoid overhand reach activities. Avoid bending over at the waist for sustained activities. Rest with arms elevated to shoulder height for standing, as well as adjust work surface to level that's easy to support and sustain. In addition, use rolling carts or rearrange the environment for easy access. So how do you manage your fatigue levels? Well, OT practitioners teach about energy conservation. And energy conservation is the means of adapting the way to carry out your daily life activities. The purpose of energy conservation is to improve a patient's quality of life by conserving energy for the activities patients need to and are interested to do within a safe and structured environment. And within energy conservation, OT practitioners teach about work simplification. And work simplification is basically the process of making activities easier and simpler to do by breaking down the step and conserving energy. The purpose of it is to reduce strains or to decrease the amount of energy required to complete an activity. Three main questions you should ask yourself. Can the job be done differently, more easily, or does it have to be done at all? In the field of occupational therapy, OTs and OTAs have an important role. The OT practitioner's role and responsibilities are to educate patients on fatigue management, teach work simplification strategies, and provide recommendations on environmental modification and adaptation. A few OT strategies to simplify work activities are to educate patients on pacing during tasks and taking frequent breaks during activities, as well as plan and prioritize daily activities by important tasks first, modification or simplification of different tasks, as well as incorporation of adaptive equipment, and lastly, delegate responsibilities to others such as family, friends, and caregivers. By OT practitioners educating elderly individuals on energy conservation and work simplification strategies and techniques, they're enabling elderly patients to engage in more activities by maximizing occupational performance with a decreased amount of stress and fatigue levels during daily living activities. So thank you for your time, and I hope you get a lot of information over energy conservation techniques. And please enjoy this fun and engaging OT activity over energy conservation and work simplification. So let's practice energy conservation and work simplification technique. Let's engage in this game called the Work Smart, Not Hard activity. Take a second and look at these two pictures. Which picture represents energy conservation or work simplification? And that's correct. The little girl that is sitting down to engage in dressing activities represent energy conservation. The girl is sitting down to complete dressing activities. She has a better stability and balance to put on clothes, and she has better control over her upper body. She's also conserving her energy by avoiding overbending and overreaching movements to reduce strain and stress on her body. Please take a second and review these two pictures. Which picture represents energy conservation and work simplification? And that's correct. The gentleman that is sitting down to engage in shower activities has better stability and balance when sitting in the shower chair. He reduced the risk of falls and slips while maintaining control over his upper body to engage in shower activities. He is conserving energy by sitting down and focusing on breathing and the activity, and no longer have to worry about harmful risks to his lower body. Next, let's look at these two pictures. Which picture represents energy conservation and work simplification? And that's correct. The gentleman that is pushing the laundry cart is conserving more energy because he is depending on the cart for assistance, while using little amount of energy to push the cart, then transporting the loads of laundry from one place to another. Now let's look over at these two photos. Which picture represents energy conservation and work simplification? And that is correct. The gentleman on the left side is displaying good posture by sitting straight up with his full back against the chair. He is also reducing the risk of back pain and body strain. And lastly, let's review these two pictures. Which picture represents energy conservation and work simplification? That is correct. The lady with the long handle reacher is simplifying her work and conserving her energy by using an assistant device to do more than 70% of the work. With that being said, the lady is also reducing the risk of any falls and stress on her body by not overreaching her shoulders and arms.